U.S. Senator Kamala Harris, she joins us now, candidate for president. Kamala, great to have you on the show this morning.
Thanks for being on, Kamala. And by the way, we've just been sitting here for a couple hours, just a bunch of old dudes sitting around smoking cigarettes, asking why people can't hit 102-mile-an-hour fastballs under their chin. So go ahead, tell us how it was last night.
How'd it go?
And how do you think the debate went?
It was great. It was great. But you know what, Joe? I have to agree with. But I have to agree with you. It was quite joyless.
Yeah.
I mean, listen. I mean, look. This is just. It's just part of the process, right? And the reality of the process is that these debates take place because of the number of people that are in the race. You know, it's a wide stage, and there's not a lot of time to talk about very important issues. And it, you know, so you see what you see.
So do you think that when the next debate comes along and we're down to maybe 7, 8, 9 candidates, do you think the entire atmosphere around the debate itself may change considerably?
I hope so. You know, listen, the bottom line, and I think you guys have said it well, and people on the stage said it last night, the bottom line is that this is an election that is going to be about which of the Democrats are going to make the most persuasive case about why we need a new president and why the current occupant of the White House should go. And I hope that we really do start to focus more on what will be the differences between who we are and the current occupant of the White House, and then give the American people, you know, clear options in terms of where people stand on policy, where we stand on what should be the standing of the United States, what should be our mission, you know, what should be our future, what should be the vision of our future. You know, there's so much about this campaign and this election that I believe is going to be a statement about who we are as a nation. And as I said last night, I strongly believe we are better than this. So I hope we can get to that point of having a real conversation about that, because there's so much at stake right now. And, you know, I'm traveling around the country, spending a lot of time in Iowa and South Carolina and New Hampshire and Nevada to start. And when people show up at these events and they show up at these town halls, they could be doing so many other things. They have big lives. And they come because they truly are invested in the future of our country. And they want to have an honest, candid, real conversation about the issues. And that's where we've got to go. You know, my agenda is about what wakes people up at 3 in the morning. And that's going to be about their health care. It's going to be about, can they get a job, keep a job? Can they pay the bills by the end of the month? These are the things the American people want to hear about, and I hope we get to a more focused conversation about what our best plan is for that.
So a lot of us armchair politicians were last night and this morning talking about how Democrats were attacking Barack Obama too much. 97% approval rating of the Democratic Party. The Affordable Care Act supported by 83% of Democrats. I asked Cory Booker about his criticisms of Barack Obama's immigration policies. I'll ask you, were you criticizing Barack Obama's Affordable Care Act last night? Do you think it was too conservative, and shouldn't Democrats be more focused on mending the Affordable Care Act and also talking about how Donald Trump's trying to destroy it?
Well, let me unpack your question. First of all, Barack Obama was an extraordinary president, and probably the best president, or one of the best presidents in our lifetimes. What he did and what he accomplished in getting the Affordable Care Act to actually come into being was extraordinary. Decades of presidents have tried to reform the healthcare system of America. Barack Obama actually did it. But in his own words, he has said it was a starter house. He has said Medicare for all is a good idea. So when I talk about my Medicare for all plan, it is about building on the success of what President Obama achieved. And, you know, when we look at it, there is still work to be done. My Medicare for all plan is about saying, let's make sure that cost is not a barrier to people's access to health care. Let's make sure that people have the option to have a private plan if that's what they want. I've traveled the country. So many people gave me feedback and said, I want to know that I also can have a private plan option under your Medicare for all system, which is why I actually came up with our own vision of what it should look like instead of just, you know, accepting the proposals that exist.
Well, Senator Harris, Joe Biden went after your plan. He said it's changed a few times, and then he talked about the massive cost of your plan, and that it's simply not feasible, especially given the cost, that things will happen that will end up being much more expensive for the very voters who really want health care coverage. Are you worried that perhaps your plan is not going to get the broad support it needs so that you can appeal to people who might be disgusted with Trump but don't want something so extreme that they're not comfortable with it?
You know, Mika, I'll tell you, Vice President Biden and I have a difference of opinion on this. The status quo is not working. In America today, 30 million people are without access to health care. When you look at the plan that the vice president is offering, as many as 10 million people will be without coverage. That's just not tenable. When I'm traveling this country, the number one issue that people talk about is health care. And it is one of the number one issues that keep them up at night. And it's a very personal issue. People want to know that they have the ability to have options when they go to a hospital, when they go to a doctor. My plan is about saying when you walk in that doctor's office, the first thing you do is you don't have to put down your credit card, you put down your Medicare card. My plan is about saying enough, we're going to get rid of the deductibles, we're going to get rid of the co-pays. The insurance companies have been jacking those up for years, and we're going to take that profit out of the process. I'm going to allow private insurers to be part of my Medicare system, but they have to play by our rules. And that's going to mean addressing the fact that the top 8 insurance companies and pharmaceutical companies last year profited $72 billion off on the backs of American families. That's just not right. And we have to bring the insurance companies under control. And under my plan, we'll do that, but also giving American people the option to have a private plan or a public plan.
So sticking with health care, Steve Ratner wants to jump in. Steve?
Senator, so just to follow up on
Steve.
Hi, how are you? Just to follow up on what Mika was saying and sharpen up a little bit, it is a fact, I believe, that under Bernie Sanders' own accounting, Medicare for all would cost $3 trillion a year. That point was made by Joe Biden a number of times, and also Michael Bennett pointed out it's 70% of our total tax revenues, and they're going to have to be paid for somehow. So that's fact one. And fact two is even your plan would eliminate private insurance at the end of 10 years. And so the question is, are the American people going, as much as we want better health care, as much as we need to improve the ACA, we all agree on that, are the American people going to vote, a majority of them, for a Democratic candidate when it comes with a $3 trillion price tag and the eventual elimination of private insurance?
So my plan does not eliminate private insurance. My plan actually allows private insurers to compete in my Medicare for All system. They have to be certified. They have to comply by the rules, such as bringing down costs, such as stopping with the plans that tell people where they can go to see their doctor, giving them more choice and bringing down costs. But private insurers are part of my plan. In terms of the overall cost, Steve, right now we are spending $3 trillion a year on health care in America. Over the next 10 years, it is estimated we will spend $6 trillion. The cost of doing nothing is far more expensive. And the bottom line is that people in America today, millions of people, are without access to health care. We have to fix this system. We have to agree. Access to health care should be a right and not a privilege of just those who can afford it.
Hi, Senator. This is Karine Jean-Pierre. So good to see you. You gave a great, impassioned speech about impeachment. If you were in front of Nancy Pelosi right now, what would you say to move her on impeachment, on moving towards impeachment inquiries?
You know, I'm not trying to move Nancy. I think Nancy is very smart. She and I would never tell her what to do. My position is that, you know, having read the Mueller report, you know, seeing that there are clearly at least 10 very specific acts of obstruction of justice that were not indicted simply because there's a Department of Justice memo that says the sitting president cannot be indicted, tells me, and if you read the report, but also if you read the memo from the Department of Justice, you'll see that it makes explicit that although the Department of Justice may not act, there is room and a place for Congress to act. And so my position is that Congress should act because there should be accountability and consequence. The beauty of our system of democracy is that we designed it in such a way that there would be checks and balances, that there would be no branch of government that has excessive power, and certainly no branch of government that can abuse their power. And so in this case specifically, where there has been clear acts of obstruction of justice, Congress must act to ensure there will be those checks and balances. So I do support proceeding with a process toward impeachment, because, listen, I've seen people go to prison for far less than the evidence that we have right now in terms of this president.
Senator Harris, first of all, you have a great laugh. I wish I heard it more. But secondly, I want to talk to you this morning, not as an old newspaper columnist, but as a voter, as a citizen of a country that I love very much. My wife and I have a bunch of kids. We've had kids treated for cancer, we have a special needs daughter, and we have grandchildren. And for the first time in my life, I am worried about my grandchildren. I'm worried about the changing culture of this country in terms of what the president is doing to divide us continually, every day. And I want to know from you, if you became president of the United States, what can you do to help alleviate my worry about my grandchildren growing up in this great country?
So, Mike, what you are expressing with such candor is what I'm hearing around the country. People are really worried. I was recently I was with a group of people in Iowa, and it was right after the president made the comments about, members of Congress and telling them to go back where they came from. And it was my time to speak after a woman spoke who talked about the effect that the president's words had on her children. And it made me so mad, because we cannot have a president of the United States who consistently makes statements, to your point, that are about dividing us instead of recognizing that we have so much more in common than what separates us, and words that are actually scaring children. And so I will tell you, and I promise you this, when I have that microphone as the President of the United States, I will always use it in a way that is about lifting people up, and certainly not about beating them down. The President of the United States has such an incredible power in that microphone she holds. And it is the power to inform our country about perspective, about who we are and how we think about issues through the lens of who we've always been. We are so much better than what we have seen out of this president. He has a fragile ego. He takes things to the lowest common denominator. And frankly, what we see is someone who does not understand that a sign of strength is not who you beat down and marginalize. Again, it's who you lift up. This president doesn't get that. I do.
Senator Kamala Harris, it is always great to have you on the show. Thank you so much,
guys.
And congratulations.
Thank you. Take care, everyone.
Coming up. Thanks. He wasn't on the stage last night, but Senator Bernie Sanders' policies and proposals were still brought up by some of the candidates during night 2 of the second debate. The conversation ahead on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.